principle, actually play a role in a whole series of things, not least in the training of medical staff and so forth. Sweeping away these strategic health authorities, sweeping away the primary care trusts, might rid us of a few annoying bureaucrats that we'd like to see put up against a wall and shot. It might get rid of a few of them. It's going to get rid of tens of thousands of loyal, hard-working NHS administrators, people who plan and develop the services, monitor the services, and ensure that the services are up to standard for you. There are 60,000 or so jobs are going to go if the PCTs are scrapped. And what's going to happen to all that work? There was a survey just recently showed the PCTs carry out an average of 300 different functions. Okay? Now, the work they do in buying services on your behalf is going to be handed over to groups of GPs. Okay? Are these groups of GPs, in addition to looking after you as patients, are they going to have time, are they going to have the energy, are they going to have the inclination or the expertise to do these 300 different additional functions that the PCTs are not going to be doing? No, they're not. So what are they going to do? They're going to wind up buying in management expertise from somewhere else. They're either going to rehire the redundant people from the PCTs, but in a less accountable structure and have them advising, or they're going to buy in private management consultants at enormous cost, you know, who've got an absolutely appalling track record. McKinsey's and these other people have been making a mess of health services right across this country, modelled on the total catastrophic failure they've had in improving healthcare in the United States. So we've got a real danger that some of these services that are currently carried out by primary care trusts will be effectively privatised. The GPs will become in hoc to private management consultants telling them what to do. And in addition to that, if we break up the primary care trust into GP consortia, they're talking about 500 or 600 GP consortiums. That's an average of 3 to 4 per PCT. That means we're going to get even more fragmentation of the NHS. It means you're going to get even less chance to actually influence what's going on. It means there's going to be no information coming out to you as to what's going on. Because the NHS trusts, which currently are public bodies, the primary care trusts, which are currently public bodies and have to publish information, will be abolished. And instead we're going to get secretive bodies meeting behind closed doors. The NHS Trust will have to become foundation trusts, meeting behind closed doors, publishing no papers, telling nobody what's going on, the occasional carefully laundered press release coming out. And all this is in the context of £20 billion worth of cuts that has to be carried through by 2014, which is probably the most important line in the white paper at all. 20 billion of cuts. That's absolutely staggering. Put it this way, if you shut down the whole of NHS London today, that saves £16 billion. Okay? The whole of NHS London, shut it down, 16 billion, still got 4 billion to find. You know? So this is absolutely cosmically large sums of money being cut out of our NHS. These GP consortia are not going to be free to purchase care in your interest. They're going to be rationing boards, cutting back services and deciding who's going to be excluded from care. That's what they're going to do in order to balance the books. And that's why the GPs are increasingly showing that they don't support this, just as the TUC voted unanimously last week to oppose these proposals. The GPs are coming out against it. The BMA, which decided they were going to engage constructively in these discussions, appears to be moving now to say that they can't carry on and that they're beginning to pick out aspects of the white paper they can't support. So we have to, that's the shortest 10 minutes of my entire life, so we have to really break the silence on this. This was publicised in a flurry of publicity when it was published back in July. We've had the summer holidays since. It's almost not at all in the papers now, this white paper and what the consequences are. So we need to be sounding a wake-up call across Barnet, across North London, across the capital, across the country. If we don't get up now and fight for our NHS and reject the proposals in this white paper and sling out these wretched Lib Dem Tory characters that are actually implementing it and actually force a complete change, we are going to watch. By 2014 we will not have a national health service, we will have a national health market. We will have the NHS funded from taxation, buying services from a variety of privatised and non-profit providers. We will go from 1 million employees in England to next to no employees in the NHS in England. People will lose salary, pensions, salary scales, etc., wholesale terms and conditions. This will be an irreversible denationalisation of our most popular public service. If we don't get up and fight for it, we'll lose it. Let's keep it public, let's keep it one pace, let's keep our NHS.
And while, just a second, Nick. Just a second, Nick. While John was talking, Shirley reminded me